All right, let's talk about this. Since yesterday's viral video from a CRNA, let's talk about all the different healthcare jobs here. And how we get there. All right, this is going to be good. So take a look at the picture I just posted, okay? It gives a breakdown. All I did was an AI search of national average compensations for each role. So what we're going to do first is talk about that and then talk about what you have to do to get to each one of these things, because it seems like everyone's like, oh man, I shouldn't go to medical school. Oh, I shouldn't do this. I shouldn't do that. You have to do what you're passionate about. And the money, everyone's going to make a good living, but it's like how much, what's going to make you happy at the end of the day? Because I promise you money isn't, okay? I promise money is not. All right, so if you look on that thing, the average, the national average for a physician is right in the middle, about 300K. The PA and NP is at around, I think, 120, if I remember. The CRNA is around 190K. Admin is going to be around, like, I don't know, 130K. And then the attorney, like 150K. And then, I'm sorry too, I wanted to do my BSN, my nurses as well. And that's around 90K. Okay, so reference that. This was literally straight off of an AI search. This varies greatly on specialty, on level of training, area, geography. Are you in the middle of nowhere? Are you in Miami, which is a vacation destination where I live? So many variables, but let's just talk averages, everyone, okay? And this one, I know everyone gets all fired up when we start talking about money, okay? So to do the doctor route, and we're gonna talk post high school, right? So 4 years of college plus 4 years of medical school plus a minimum of 3 years of residency. I did 6, and there you can do even more than that, right? So we're at 8, 9, 10, 11. So 11 years post high school to become a practicing physician. Now, granted, during these 3 years, you make a little bit of money as a resident, but it's peanuts on the dollar. It's $50,000 to $60,000 for 80 hours a week, okay? And we're not talking hourly here. Again, everyone's getting all crazy. We know that that post was including, with the CRNA, was including a bonus. So it's, it's not real. I want to give you guys the real data, okay? So BSN, 4 years, right? After high school, you have to pass your exams, and then you're working as a nurse. Again, where you work and all these things are going to matter dramatically as to what you're going to get paid, but artificial intelligence tells me that this is the national average, okay? These two, interesting. Now, the NP, you're going to, I believe, get your BSN, right? And then you're going to do an additional doctoral kind of training. And you guys help me, correct me if I'm wrong here, because this I'm not an expert at, but I believe that's like 2 or 3 years. Not sure, help me in the comments. But again, these two, you're now working under a physician for the most part. There are NPs and PAs, especially in the aesthetic space, because we own an aesthetic practice, my wife does. But we have a medical director. So they're always going to be working under a medical doctor's license. But again, great specialty, and I'll get into why I think these two are really good options in a minute. PA, actually great route, because high school plus 4 years of college plus 2 years of PA. So you're only in 6 there. Again, here you're in, again, probably at least 6. This one you're in only 4, okay? So again, we're trying to just get an idea of how much time, effort goes into this. The CRNA one's good, is interesting because of that discussion yesterday. So again, they earn a really good living. They make very good money. So BSN, then you need to do, I believe it's at least 1, but most likely 2 years in the ICU, which is important. And then you have to do your program, which again, I think is another, like, say 2 to 3 years. So you're talking 4, 5, 6, 7, maybe minimum 8. So again, everyone gets all bent out of shape about this stuff, but they're actually putting in, a lot of time here, guys. A lot of time into your education. So that's why this carries a higher price tag, okay? But again, now you're working under an anesthesiologist, but there's a lot of autonomy here in all of these, which is nice. Do you want to do like healthcare administration and work in admin? And here's the lower levels. But again, now you're like CEOs are making, they're in the $1 million range here. So this also varies dramatically, and the attorney one varies dramatically. So I'm kind of going to leave this one out of the discussion, but I just wanted to throw it in there too, because it is part of this whole machine. So where my talking point I want to go now for the younger folks out there that are deciding what they want to do. So when you become a physician here, you're a doctor, but then you have to do your residency, okay? So then this really locks you into something. So for 3 years, maybe now you're an emergency medicine doctor, an internal medicine doctor. That's what you're boarded in, and that's what you're going to practice for the rest of your life. The cool thing about being a PA or an NP is you get this degree and you can switch. So, I was in derm. Then I worked in the ICU, in the medical ICU under the pulmonary and critical care doctors. Oh, I didn't like that anymore. I want to be in the OR. So then I worked with a general surgeon. The NP route, you do select a tract or a specialty. You guys can help me with what that's called. So there is like a critical care tract. There's like a family medicine kind of a tract. So this essentially locks you in a little bit more like our residents. Whereas the PA, honestly, you can just pivot at any point where you're kind of like annoyed by being in a derm clinic all day and you're like, I want to be in the OR. I think that's super cool. And then again, I think something to think about here is this is a big price tag. I mean, you're close to here, and as we learned yesterday, some of the CRNAs are getting paid more than some of our, our primary care physicians, unfortunately. That's just the hard truth. So I think this is a great talk in lieu of yesterday. Take a look at the picture I posted, and I really wanted to share this. I think it's important, especially for my young aspiring healthcare professionals out there, healthcare people.